Millions of Chinese are taking to the streets to protest their country's harsh COVID-19 regulations, as well as vaccine mandates. Meanwhile, Canada's province of British Columbia is set to codify its own version upon its doctors, dentists, nurses, and other healthcare professionals. One America's Neil W. McCabe has more.
The British Columbia New Democratic Party and its leader, Premier David Eby, are poised to codify in legislation new rules punishing any and all health professionals in the province who are not current with required vaccines, with loss of license, massive fines, and/or incarceration. Dr. William Mackis, a nuclear medicine radiologist and oncologist based in Alberta, told One America News his concerns about the clampdown in British Columbia.
Section 49, for example, makes mandatory vaccinations, that includes COVID vaccines, it makes it a license requirement. So now, in order to have an active license to practice in BC, whether a doctor or a nurse, you will need to have the required COVID vaccinations that the government decides, maybe every 3 months if you need vaccines to keep your license active. The misinformation clauses where they encourage other doctors to report other doctors, nurses to report other nurses for COVID misinformation.
There's other stuff in there about fines and prison sentences for spreading misinformation. So I don't know what point I'm going to jail if this carries on. And then there's also stuff about them being able to basically close your practice and seize all your property and investigate you. And so it's pretty draconian.
Reporting for One America News, Neil W. McCabe, North American Desk.